You have probably already done the research. You have read the reviews. You have compared the brand names. Maybe you even answered a few questions online and got handed a lens as the answer. And you still are not sure because somewhere underneath all of it, you know the box does not know your eyes. If that's you, this video is for you. For those who are new to my channel, I'm Dr. Audrey Tai, board certified and fellowship trained cataract and refractive surgeon. Welcome to iChannel by iSurgeon. I perform about 500 cataract and lens replacement surgeries per year, and over 95% of my patients choose advanced lenses or laser technology. Today, I want to answer the question I get more than any other. Should I get an EDOF lens or a trifocal? And I want to tell you why this is not actually the first question. I always tell my patients there's no best lens. There's only the best lens for your eyes and your life. The brand on the box is not the decision. The trade-off is a decision. So let me show you the real trade-off and the way I explain it in my own consultation room. So what does an EDOF lens actually give you? EDOF stands for Extended Depth of Focus. Think of it as one smooth, stretched range of vision. It gives you clean distance, comfortable intermediate, and functional near. The reading is usable for most of daily life. The phone, the dashboard, the price tag. What you trade for that smoothness is the very sharpest fine print. And what you gain is forgiveness. Fewer rings around lights at night. A more natural picture when you're driving home in the dark. For the patient who values clean night vision and a relaxed range over reading the smallest type, EDOF is often where I land. So what does a trifocal give you? A trifocal is built to give you 3 defined focal points: distance, intermediate, and the stronger, crisper near. If your day depends on real reading, small print, a contract, a manual in low light, a trifocal usually delivers more of that close range. What it asks of you is more tolerance at night. Some patients notice more glares or halos around headlights, especially in the first months while the brain adapts. Most adapt well, some don't. I always tell my patients the truth about both outcomes because I have seen both. So how do I actually choose? This is the part the quiz cannot do. I do not start with the lens. I start with you. I ask how you spend your evening. I ask how much you drive at night. I ask whether your work lives on fine print or on the screen at arm's length. I look at the health of your eyes, your retina, your tear film, the measurements no website can see. And here's a third option most patients never hear about. Sometimes the right answer is not one lens type in both eyes. For the right patient, I'll set up a small, deliberate difference between the two eyes, what we call mini monovision, often using an EDOF lens to widen the usable range without asking too much of either eye at night. This is not a brand, that is a plan. And sometimes I may place 2 different types of implants each eye. One eye may have a trifocal implant, the other eye has an EDOF lens. And it really depends on the lifestyle and the vision needs. That's how we come up with the plan. Not the lens, not the brand, the match. That is a decision. So why does the surgeon matter more than the brand? Because the same lens can be a great result in one eye and a disappointment in another. The technology is only as good as the measurements behind it, the plan around it, and the hands placing it. I always tell my patients that a good surgeon does not hand you a catalog and ask you to pick. A good surgeon listens to how you actually use your eyes, then narrows the choice for you and tells you honestly what you are trading either way. You should walk out with one recommendation and the reasons behind it, not a quiz result. And I will be honest with you the way I'm honest in my own consultation room. These are excellent lenses, but no lens is perfect. And just like any eye surgery, the risk is not zero. That is exactly what a consultation is for. A real plan built on your eyes, not a brand you read about online. So what should you do next? If you're someone who researches before you commit, you have already done the hard part. The last step is not picking a brand. It is finding a surgeon who will tell you the honest trade-off and match the lens to your life. The team at Athena Eye Care can schedule a consultation, and the link is in the description. To understand the full menu of lens options first, you can watch my video on how to choose a cataract lens. I'll link it below. Let me know in the comments. Did you walk in already set on a brand? And did a surgeon ever explain the trade-off to you? I read every comment. If you learned something today, please hit the like button, subscribe to my channel, and turn on the notification bell, because that helps me continue to bring free videos about eye health and eye surgery to the world. Thank you for watching, and I will see you in my next video.